Okay, so now we're going to talk about two drugs, a cholinergic agonist and a cholinergic antagonist. So the first drug we're going to talk about is the cholinergic agonist. This is an indirect cholinergic agonist. This is pyroreceptors. When it's in high doses, it's nicotinic, but when it's in just lower doses, it's a muscarinic receptor. It affects those. So I am not sure how to say it. It's for myasthenia gravis. So this drug is going to work by increasing acetylcholine. It is going to increase acetylcholine by inhibiting acetylcholinesterase. Acetylcholine by inhibiting acetylcholinesterase. Not saying that correctly, but I'm trying. It stimulates the intestines, the bladder. It's going to constrict pupils, increase salivation, increase sweating, decrease heart rate, and cause a dilatation and bronchoconstriction. This is a cholinergic agonist. An adverse effect can be a cholinergic crisis, which would lead to sludge drugs are cholinergic drugs, and anticholinergic drugs are anti-sludge. So there's sludge. Remember we talked about it increasing salivation, increasing sweating earlier? Kind of goes along with this. Sludge drugs, just kind of think of them as wetting. I know that atropine would be the antidote for be going to the bathroom. So that's pyridostigmine, and that's the cholinergic agonist. Now we're going to talk about the cholinergic antagonist, which is a cholinergic blocker. This is atropine or belladonna alkaloid. And it is from the belladonna plant, which is a nightshade plant. It's quite pretty. Sludge, you're going to have stopping or ceasing, or I guess you just say stop, anti. It's going to stop salivation, stop lacrimation, stop urinary incontinence, stop diarrhea, stop GI cramps, and stop emesis, stop throwing up. So these drugs, it's going to be anti-sludge. So stop that. An adverse effect is going to be too much dryness. So you can have dry mouth, constipation, and urinary retention. It's going to increase the heart rate. Remember, irritability, patients who experience dilated therapeutic index or a narrow therapeutic index, if that helps you to go better. And there is an antidote, and the antidote is there. I'm probably not saying it right. 5 to 9? I think that sounds right. Another nursing implication is that with the elderly, there is an increased risk of heat stroke. So you should tell them to limit their physical exertion and avoid high temperature settings or strenuous exercise. They also need to increase their fluid intake and decrease their salt intake. Antagonists. Cholinergic agonists, just think of it as a cholinergic. Cholinergic means sludge. Sludge is wet. Think of like mud and sticks and, I don't know, water and dirt and all that jazz. It's sludge. It's dryness all over the body. These drugs are going to be causing wetness. Think of it as all the bodily fluids that you could possibly create, whether it's tears or spit or sweat or urine or feces or vomit. That's another bodily fluid. This drug is going to increase the wetness. This wetness. Anti-sludge, sludge. Anti-sludge, anticholinergic or cholinergic blocker or cholinergic antagonist, cholinergic agonist, or just cholinergic. There we go. Those are the two drugs. Who knows?